Welcome. My name is Dr. Isabel Edge, and I'm here with Dr. Jo Marie Reilly and Ilana Greenberg and Wendy Silva representing the Keck USC School of Medicine. Our poster is entitled Student-Led Virtual Nutrition and Exercise Classes, Unique Challenges and Opportunities for Students and Patients. As background, it's well established that diet and exercise are integral to chronic disease prevention and management, but physicians in training receive little instruction on how to counsel patients on these topics. The Keck School of Medicine primary care program began hosting student-led nutrition, cooking, and exercise classes at the LA County Wellness Center in 2017. In 2020, due to the COVID-19 pandemic, we pivoted to offering classes virtually, live stream, and also recorded. We evaluated the students and community participants' experiences with these virtual classes. We hypothesized first that medical students would report an increase in confidence and likelihood to counsel patients about nutrition and exercise, and increased proficiency in virtual healthcare delivery. And second, that community members would report an increase in knowledge regarding healthy eating and exercise and reduced barriers to attending virtual classes compared to in-person.
I will now discuss our study methods. Participants included 31 first and second year Keck primary care program students and 50 community members. Between September and December of 2020, students taught 12 virtual nutrition, cooking, and exercise classes on Tuesday afternoons. The classes were conducted in an English-Spanish hybrid and live streamed via Zoom and Facebook Live and also recorded. Community members were invited to attend the classes through website promotion, flyers, word of mouth, and social media. Medical students who led at least one class were asked to complete a 14-question survey about their experience. Community members were also asked to complete a survey after 10 of the 12 classes. The survey was in both English and Spanish and included 12 or 19 questions, depending on whether participants attended one class or both. Data analysis was conducted through Qualtrics and qualitative coding by a member of our study team. And as you can see here, we have two photos from our nutrition and exercise classes with our medical students teaching and using props and the technology setup we use to transmit the classes online to community participants.
And now I'll be going over the results, starting with the student data. There were a total of 35 survey responses from 31 unique participants with a response rate of 76%. All students, 100%, were very satisfied, 69%, or mostly satisfied, 31%, with teaching in a virtual format and thought the virtual format was very effective or mostly effective for information delivery to patients. All respondents strongly agreed that 69% or agreed 31% that teaching at the Wellness Center increased their confidence in discussing healthy eating and exercise in a simple way to patients in the clinic. All respondents also thought that teaching at the Wellness Center was very effective, 77%, or mostly effective, 23%, in increasing the likelihood that they would counsel patients on eating healthy and exercising in the clinic. Students noted two main areas of impact that teaching a virtual nutrition and exercise class had on telemedicine skills. These two main areas were specifically engagement skills, with 23 respondents reporting this, and communication skills, with 21 respondents reporting this. And within engagement skills, students learned check-ins with specific techniques of asking questions, pausing and teachbacks, also encouragement and motivation, and eye contact. The communication skills that students learned were verbal cues, with 14 respondents reporting this, and visual aids, with 7 respondents reporting this. Within verbal cues, specific techniques learned were animating the voice, speaking clearly, and exaggerating the body language. And within visual aids, specific techniques learned were using websites and pictures and other. For community data, there were a total of 125 survey responses from 50 unique participants with a response rate of 33%. Community members experienced the virtual nutrition exercise classes, and among the respondents who attended the nutrition class, 88% reported being very satisfied and 11% reported being mostly satisfied with the class. Among respondents who attended the exercise class, 89% reported being very satisfied and 10% reported being mostly satisfied with the class. Among the community members, 98% also reported that they would watch a future nutrition class, and 97% reported that they would watch a future exercise class. Our community members gained a lot of knowledge from the class, and among our respondents, 97% reported that they would make a healthy change in their eating based on what was taught in the nutrition class, and 98% reported that they would make a healthy change to how they exercise based on what was learned in the exercise class. Among our respondents for the nutrition class, the four most common things learned were specific recipes, portion sizes, eating more vegetables, and eating fewer carbohydrates. Among exercise class respondents, the four most common things learned were stretches, balance exercises, specific exercises, and the health effects of exercising. Largely, our participants did not have a preference for attending the classes virtually versus in person. However, among those who did have a preference, there was roughly an even split between a preference for virtual and a preference for an in-person class. However, there were some barriers identified within our respondents to attending a class in person. The most common barrier included child care. The other barriers that our respondents talked about were COVID-19 risk, distance, transportation, mobility, and timing. And these can be seen in our second graph below.
Our Keck School of Medicine student-led education and nutrition classes allowed for several things. First, they allowed for student education and service learning during the pandemic. Second, they allowed for our community members to still access nutrition and exercise resources for their chronic illnesses during the pandemic. And lastly, these classes allowed for a replicable model that other institutions can use for nutrition and exercise teaching for students and community members. Some tips that we learned that we'd suggest for other programs. First is to know your technology. So important before you start to know how you're working that. The second is ending and starting on time is really important for the participants who are logging in virtually and want to know where you are. Third, the exercises can be modified in simple ways, like using cans of beans, cans of vegetables, instead of using weights, so that patients can do these at home without equipment that they might need at home. And lastly, we found it was really important to advertise these classes in multiple modalities and even offer raffles each week to increase class attendance.
So in conclusion, student-led nutrition and exercise classes benefited both students and participants. Students gained confidence in lifestyle counseling and valuable skills in virtual teaching. Participants gained knowledge about specific nutrition and exercise topics, and at least a portion of participants preferred virtual classes. Many participants noted reduced logistical barriers to attending virtual classes compared to in-person. Given the success these virtual classes had and the likelihood that virtual healthcare will probably remain a part of primary care, we intend to continue to offer a virtual option for all of our future classes. We thank you very much for your attention, and please feel free to reach out with any questions or comments.